Bismillahirrahmanirrahim. Assalamualaikum and good evening, everyone. So, today's topic will be body mechanics, which is prevention and management of low back pain and injuries. When we talk about body mechanics, apa yang kita boleh kaitkan adalah your body posture, bentuk badan awak. Next slide is health problem associated with poor posture, poor body posture. We have 6 actually. Number 1 is forward head, kyphosis, lordosis, abdominal pitosis, hyperextend knees. After this, we go one by one, and the last one is scoliosis. Okay, now we go one by one. Number 1 is forward head. You can refer back to our previous slide. Forward head. The definition is the head is aligned in front of the center of gravity, forehead, mana kepala dia ke depan sikit. And the head problem may cause is headache, dizziness, pain in the neck, shoulder or arm. Next is kyphosis, excessive curvature, flexion in the upper back, hump-back. The head problem is impaired respiration, pain in the neck and shoulder or arm. Okay, when we talk about kyphosis, tu maknanya kalau awak tengok orang tu jalan bongkok je, kyphosis lah tu. At least minimal ke, maximal ke, biasanya minimal je lah. Sebab tu tak nampak sangat. Okay, next problem is lumbar lordosis. Lumbar lordosis. Definition is excessive curvature, hyperextend in lumbar region with a forward pelvic tilt. The head problem is back pain or injury, protruding abdomen. Protruding abdomen ni maksud dia abdomen awak ke depan, perut ke depan lah macam tu. Dan dia berkaitan juga dengan abdominal pitosis, which is protruding your abdominal, may cause back pain and or injuries. Next is hyperextend knees. Knees bend backward excessively. Head problem, it may cause greater risk of knee injury. Dan biasanya orang yang kena hyperextend knee ni susah dia nak buat squat, bahaya untuk dia. And the last one is scoliosis. Scoliosis is lateral curvature with some rotation of the spine, back pain and or injury. Maknanya tulang belakang dia ada curve sedikit. That is scoliosis. Next slide is your lumbar curve illustration. Number 1 is excessive lordosis. Next is high normal lordosis. Next is low normal lordosis, hyperlordosis, and the last one is lumbar kyphosis. Okay, here are the illustration for all those curves. Next is illustration of pelvic tilt and sacral angle. From this illustration, apa yang awak boleh tengok adalah the illustration and the explanation is below here. Contoh sebagai yang pertama adalah your pelvis is normal, your pelvic is normal, your sacral is low angle, and your lordosis is hypo. Refer back to your previous slide, macam mana hypo tadi. And same goes to the others. Next slide is your body alignment, and please take note that your soft tissue rarely tell the real story about your body alignment, which is your bone. Maksudnya tak semestinya badan awak banyak lengkung, maksudnya tulang awak bengkok. Tak, sometimes your soft tissue, your muscle tissue lain bentuk dia. Dia tak semestinya ikut bentuk tulang awak. Inilah contoh-contoh dia. Next slide is muscle imbalance and lower back pain. Apa hubungan muscle imbalance dengan lower back pain? For example, long strong back muscle. Biasanya kalau back awak kuat, your chest akan tak kuat macam tu. That is imbalance, your muscle imbalance. Strong abdominal muscle. Bila you have a strong abdominal muscle, your back will weak. Your lower back will be weak. And long hip flexor may cause your hamstring weak. Same goes to long strong hamstring may cause your quadricep become, your hips become weaker. Contoh sini, weak short back. Here are some back tests you can apply. Number one is back to wall, straight leg lift, elite test, drop test, press up, and knee roll. Next slide is stretching exercises for the hip flexor, hamstrings, and pelvic stabilization. Number one is back saver hamstring stretch, and next one is hip and thigh stretch. Next is stretching exercise for the abdominal. Number one is single knee to chest, knee in, supine trunk twist, and the last one is cobra pose. Next is postural training exercise for pelvic stabilization. Stabilization is pelvic tilt, pelvic rise, rest, pelvic single leg rest, and pelvic stabilizer. Next is abdominal exercises, crunches, elevate curl up, reverse curl, oblique crossover. And here are some exercise for your lower back exercise, which is bridging, side bridging, and the last one is alternate hand and leg. And the last one is lumbar stabilization exercise with Swiss ball. You can do wall squat, bridge with machine ball drop, bridge ball hack, standing ball hack, balance push up, machine ball. Okay, all those exercise termasuk yang slide yang previous tadi, this is exercise for you to avoid muscle imbalance. Yang tadi tu saya cakap, kalau chest awak kuat, upper back awak tak kuat, it may cause injury to your upper back. Same goes to your abdominal kuat, your lower back tak kuat, lower back awak injured. Lower back awak kuat, but your abdominal tak kuat, may cause injury to your abdominal. Same goes to hamstring and quadricep. That is muscle imbalance. Next slide is yoga for the core. Here are some examples with illustration for yoga exercise for your core. Number one is warrior pose. Next is standing side stretch. And next one is revolve abdomen pose. Next slide is revolve abdomen pose for advanced athlete. Yang tadi kalau awak bengkokkan kaki tu just for beginners. Tapi kalau dah biasa buat, you straight up your leg and then you do revolve abdomen pose. Next slide is your exercise that you can do by using resistant band or kita panggil TheraBand, ada juga orang panggil TheraBand, resistant band, that you can do some stretching and also exercise. The first photo here is that hamstring stretch, groin stretch, and the last one is quadricep stretch. Next is back extension and reverse curl and crunches, plus crunches. And for our last slide for resistant band training is standing side bend and side bridging by using band, resistant band. So I think that's all for this topic. Thank you. See you when I see you.